Good afternoon, everyone. For those that are in our time zone, those that are on the West Coast, good morning. We know that we are expecting a large number of participants. People are going to continue to come on. I am Jen Manlett. For those who don't know me, I'm the Chief Development Officer here at JCC Association. It's wonderful to see so many familiar and new faces on this call. I will start by just letting you know who's in the room here with me that you can see. There are some people in the room that you can't. Right to my left, your right, is Gabe Most, our Chief Experience Officer. To my right, your left, is Mark Young, our Director of J-Response. They have been leading the way with our staff here at JCC Association on making sure that all of the information you've been receiving over the last many days has been coming to you. I personally want to thank them on behalf of all of you and the field. It has been amazing to watch them work so well and to lead our team here. Also in the room who you can't see is Daron Krakow, our President and CEO, unusually shy for the moment, and Bernardo Arocho, who works on our IT team and is making sure that everything works well for us this morning. So just a few housekeeping items, and then I'm going to kick us off pretty quickly. If you haven't noticed already, all of you have been muted, and we're actually going to ask that you remain on mute. Questions today will be received to us via the chat function. If you don't know how to use that, on the lower part of your Zoom screen, there is something called chat. You can click on that, and what we're going to ask is that you submit your questions specifically to JCC Association, not to everyone. That way we get them more directly. I will monitor them and feed it to our guest speakers at the appropriate time. So if you have questions, you can even begin to submit them now, but I have a feeling several of those questions might get answered, so you may want to wait at least a few minutes. The format for today's call, I am thrilled to say that we have two of our colleagues from the Redwoods Group. For those that know, Redwoods has been a strong partner, not only of JCC Association, but of our movement for many, many years. And today we are grateful to have both Jody Bagwell, the Chief Claims Officer, and Dan Norber, the Chief Data Officer, with us on the call. In a few moments, I'm going to turn it to them, and they are going to answer the following three questions for us. What is business interruption insurance? What insurance could be triggered and how? And what can you do right now? Following their presentation, we're going to ask Joel Dinkin, our dear colleague and board member at JCC Association. For those who don't know, Joel is the CEO of the Evelyn Rubenstein JCC in Houston. Joel is going to reflect with us about his experience in 2017 when his JCC was suddenly and unexpectedly closed following Hurricane Harvey. There are a number of lessons that we can all learn from Joel's experience, and Joel, I just want to thank you for joining us to do this with us, as you so graciously do whenever we ask. So with that, I am going to turn it over to our colleagues at Redwoods, to Jody and Dan, and ask them to take it away.
Good morning and good afternoon, everyone. I'm Dan Norber, for folks who don't know me, which means that this is Jody Bagwell. I have the important but unenviable task of trying to cover the what is business interruption insurance in 5 minutes or less, or thereabouts. And the reason I say unenviable is because if you all have started to look at your business interruption insurance, you know that it's complicated and there's a bunch of different layers to it. And so I don't operate under the delusion that I will clear everything up in 5 or 6 minutes, but hopefully in hearing somebody say it rather than just having to read insurance words, that it's a little bit easier to understand maybe what you have and then come back to how that works. So generally speaking, business interruption insurance is the piece of your insurance policy that is meant to make you whole if your facility is closed, right? So that means that it covers the income that your organization produces and the expenses that your organization incurs in normal operations. And then there's also a second coverage that is almost always in line with it and provided alongside of it, which is called extra expense coverage. So if you have extra expenses that are required to get your operations up and running, there's a separate coverage that's a sister coverage to business interruption that's also often in place. So that's generally speaking what it covers. The way that it typically gets triggered is it's part of the property line of insurance. And so one of the reasons that it's a little bit confusing right now is that when you think about property insurance and you think about what would be a property thing that would shut down a facility, you're thinking about natural disasters. And so the insurance coverage as it's written is most of the time, most specifically speaking, about natural disasters. And so that's what makes it a little bit strange here, is that it's not, we're not talking about a hurricane, we're not talking about a fire, we're talking about a virus, which isn't a property thing at all. So Jody will talk a little bit more specifically about how that may interact with the coverage, the idea of a virus and how the coverage hits. But know that when you're thinking about business interruption coverage, it's really written in response to these sort of natural, these natural mega issues, as opposed to being written specifically for issues of pandemics. So that's what it is, and that's how it's triggered. And if that was all there was, that would be fairly straightforward. But probably the most challenging piece is that there's actually 3 or 4 different types of business interruption insurance that you can provide. So I'm going to try and do this without being really, really wonky. But it's important to understand that there are options, because in that there are choices. Obviously, whenever you're buying an insurance policy, the choices carry prices, and then the choices carry implications for how much coverage gets triggered. So in no particular order, one of the types of business interruption insurances that some of you may have is what's called a monthly indemnity limit. So monthly indemnity limit means you tell the insurer how much business interruption insurance you want, and then you also tell them what fraction of that insurance you want access to in any one month. So quick example, if you buy $12,000 worth of business interruption insurance and you set the fraction to 1/6, then in any month you would only be able to capture $2,000 of business interruption value, right? That's the way that monthly indemnity works. So that's important. It's really important for JCCs to understand that, especially if you have a camp, because if you have a business interruption, whether it's coronavirus or something else, that hits you in the camp season, it may be that if you have monthly indemnity, you don't necessarily have a smooth income statement, and you want to make sure that you have purchased limits that are reflective of how much insurance you would need if you have a camp closure, or if you have an off-site resident camp or resident camp closure. So that's monthly indemnity. The second type of business interruption insurance that we see is called co-insurance, which is basically you say, here's how much income I have, here's how much revenue and expense I have, and I'm going to cover X% of it, and I want you to cover the other X% of it. So I have $1 million of revenue, but I think that I only want to buy coverage for about $500,000. So I'm going to have co-insurance on the other side. So you select the total limit, you select the percentage of co-insurance, and then if you end up needing that insurance, then you should expect to be asked for some verification of your financial performance, because if you underinsure, then there's a penalty in co-insurance. And so you should just be aware of that when you're selecting your insurance levels and your co-insurance, that you should base it on your actual historical billings, because if you don't, you may not have full access to the limits that you thought you have. That's number 2. Number 3 is probably the simplest and most straightforward, which means maybe I should have started with that one, but it's called actual loss sustained. So that one's just tell the insurance company how much revenue you have, and that's what you're covered for, right? So that one's straightforward, and then in the event of an issue, then you're covered for that much, and you'll still get questions about your actual billings, but it's really straightforward. So those are the 3 major types, and probably you have one of those 3 types of insurance. There's maybe 1 or 2 other variations that are that we very rarely see used, that we have not issued, but may very rarely be used in the insurance industry. So the reason that matters primarily is because you ought to know what you got, and you ought to know how you access it. So we talked about with monthly indemnity, which is a common choice, just making sure that your insurance limits match up with your revenue profile to make sure that you could buy insurance, but not actually be able to recover the amount that you need to offset your losses. And also to be aware of what you might be asked to provide in the instance that you do have a business interruption claim, whether it's for a virus or some sort of other property event. You should expect to be asked, both in terms of when it gets priced, but then also in terms of how you recover, to see that sort of information. Regardless of which policy you have, and this is my last point, and then I'll turn it over to Jody. Regardless of which policy you have, you should expect to see a couple of common things. One is a total limit, right? So each policy is going to only pay out up to a specific amount. The second thing that you should expect to see is a waiting period. So just because your facility closes does not mean that business interruption coverage immediately kicks in. Policies will have a waiting period that's, again, there's some ability to select that, and obviously the shorter the waiting period, the more expensive the insurance tends to be because there's more coverage. And then there's a period that will be covered. So this is maybe less important, hopefully, where we are now in terms of the length of time that your policy will provide coverage, but all policies are going to have a standard length of time for which an event will provide you access to business interruption coverage. So if you're still awake, and I hope you are, that is business interruption coverage in a nutshell. We'll come back to the things that you can do right now, but if you are feeling cross-eyed or looking around the table and feeling like I understood about a quarter of that, your broker is absolutely the best person to talk to next, because they are your advocate and they are the ones who are helping you figure out which coverage to buy and which coverage to place. So that is business interruption insurance. We're dealing with the business interruption component and then also potentially the liability component in terms of what happens if people get sick. So I will turn it over to Jody for a couple of minutes on what could trigger either of those insurances and how you should be thinking about whether and when you might be covered.
Sure. Thank you, Dan. So one of the areas we have been focused on for the past several weeks when looking at the property policy that we issue is there's an endorsement under the property policy that we write, which is called the Food Contamination and Communicable Disease Coverage Endorsement. Right? That's a really long, wordy endorsement. But with the coronavirus, outbreak, that is one area where we have identified that there could potentially be coverage for loss of business income. One of the key points or factors in that endorsement is it states that if your facility, or it actually states in the endorsement, the described premises in the endorsement is closed or suffers a business income loss, you would have to close because of an outbreak at your particular location, and you would have to be closed down by civil authority, or not civil authority, the Board of Health or a governmental authority. So to try to make that really, really simple is if you have, an outbreak at your facility or your camp that is insured that, contains this endorsement, and the Board of Health comes in and says you have to shut down because of this particular outbreak at your facility, then you should have coverage under this endorsement for your loss of business income.
And Jody, you're talking about the Redwoods policy, but that's a pretty common endorsement, or one that if you have a property policy, whether you're a Redwoods customer or not a Redwoods customer, you should be looking for because they show up sometimes.
Yes, you absolutely should, just to see if that endorsement is attached to your particular property policy. The area that is really, really gray is going to be under the general liability policy. The general liability policy is usually triggered if there's an occurrence that results in bodily injury or property damage, and all three of those terms are defined in the GL policy. The first of those being an occurrence, which is basically an accident, including continuing or repeated, exposure to the same general harmful conditions. Whether or not the coronavirus or someone is diagnosed with the coronavirus at your facility is an occurrence is really, really up in the air at this point. And in my opinion, I think it could even be venue specific as to whether or not that would be defined as an occurrence in the policy. So the GL policy is going to be really, really tricky when it comes to someone bringing forth a claim because of the allegation that they contracted the virus while they were at your camp. Now, coverage aside for that, like I said, that's still up in the air. Proving negligence or liability against an entity for that, in my opinion, is going to be really, really difficult from plaintiff's side. So those are the two policies that we think could be implicated based on what we're hearing. Workers' comp is a whole different ballgame, and whether or not this illness would be covered under workers' comp policy, I don't think they have landed one way or another on that at all. But that's the coverage breakdown, if you will, based on some pretty specific scenarios under your commercial property policy with that endorsement, and then potentially under your general liability policy.
Dan, sorry, it's Jen. We have one question, and before we move on, I'm not going to keep doing this, but I don't want to move too far past this. Jody, a question for you is about civil authority coverage. Can you talk about that?
So civil authority coverage, you would not have coverage, is my understanding, just with the civil authority coverage. The food contamination and communicable disease endorsement attaches at the end of the civil authority coverage in the causes of law special form.
Okay, thank you.
Yep.
So obviously, anytime you're talking about what triggers an insurance policy, it gets very complicated very fast. And as Jody points out, there's a couple of places that you should look in your policy, or to look with your broker at what might trigger. So the endorsement to the commercial property policy that Jody's talking about is one that I know gets some airtime because there's often conversations about bacterial or fungal components, and this being a virus, how does that play? And so those nuances are the things that you just want to be talking about with your broker and understanding where in your policy you ought to be looking. In terms of the GL, in terms of people getting hurt, in that sense, I don't think it's that much different than the flu, right? So if somebody gets sick, if someone gets the flu, saying I got the flu at the JCC versus I got coronavirus at the JCC, obviously we talk a lot more about coronavirus now with good reason, but in terms of a claim or triggering liability, they're fairly similar in that sense.
They are. The one issue there is, again, going to be whether or not it's an occurrence. Like, is someone catching the flu or the coronavirus, is that an accident, right? Legally speaking, right, in the policy. And I think that's going to be up for debate.
And again, maybe determined by what kind of venue you're in.
Yes, absolutely.
So the three things before we turn it, I guess over to either to Jen or to Joel, is you can't prepare for every potential outcome, right? You can't possibly think of every potential thing that could happen and try and create a plan for every single potential outcome. But you can understand where to look to see what you might have coverage for, so that you can ask better questions of your agent, and ultimately, if you need to, approach your insurance provider as a partner to say like, hey, I'm reading this, here's what I'm seeing, let's talk about this, here's what I'm seeing on the ground. In terms of preventing the coronavirus, I think that you all had a chance to engage with folks from the CDC either earlier this week or last week, and I think that everybody's looking to them and similar organizations that are really focused on communicable disease in terms of how to stop it from spreading. So in terms of prevention, we would steer you back to where JCC Association has already provided you some resources. And then I think the third place that I would say for right now is to get a handle on the type of business interruption coverage that you have. And the reason that I say that specifically is because we're getting close to camp season, and camp season often creates a spike, hopefully mostly positive in terms of revenue for JCCs, and you want to make sure that you know what kind of coverage, what kind of protection that you have if it gets triggered. So those are the three takeaways in terms of insurance that we would recommend thinking about right now. And obviously, if there are questions, we'll do our best to answer them as they come in. So Jen, I'll put us on mute and transfer it back to you.
Wonderful. Thank you both so much. I'm just going to do a very quick recap of a couple very important things that I heard, because we're seeing people coming in and joining the call late. I'm not going to try to recap at all the detail because you both did that incredibly well, but I just want to remind people that one, it's really important that you know what you have and how to access it. That if you're wondering who you're supposed to be speaking to about information, Dan reminded us that it's the broker, your insurance broker, who is your advocate, and the person with whom you should be in direct contact if you haven't already. With that, I'm just going to turn things over to Joel and ask him to please share his important and meaningful reflections from his experience a couple years ago. Joel? We're going to unmute you, Joel. Give us one moment. There you go.
That's a pretty neat trick, Jen. I think one of my staff would like to be able to mute and unmute.
I'll teach them how.
So I'll try to help out as best as I can. When Gabe asked me the other day to participate, so as it turns out, as I was thinking about it, about 90 days before Hurricane Harvey struck Houston, we had just upped our allotment or our allocation of business interruption insurance based on where we were from a program standpoint. As it turned out, and to be expected, business interruption that was caused by flood was excluded from our policy. So therefore, anything that we incurred as a loss was not covered through business interruption. So having said that, we were never really concerned as through this process about the recapturing the program revenue. Our first and foremost priority was staff. And that the fact that we were closed for, the main building was closed for 2 months. We were doing some offsite programming for 2 weeks afterwards. We wanted to make sure that we provided for our staff, both the staff that had flooded, as well as the staff that were not able weren't able to work. And we made a decision at the get-go within a few days that we were going to keep staff on the payroll for a month, even without even knowing how much we were going to be, how long the closure was for. We weren't, how we were going to pay for it, to cover it, was not even a concern at that point, because we knew that at some point we were going to reopen, and that we would need our staff to do their work, one. But also at the same time, we wanted staff to know that they could count on the JCC during this crisis, and that they would have a paycheck for up to 30 days, so they can provide for themselves and their needs, etc. So that was our primary driver here in regard to the decisions we made as far as the closure and recognizing that business interruption was not going to cover anything, and what was important both in terms of how we want to respond to those individuals who were important to us, and in addition to that, recognizing that at some point we were going to be open and operational, we needed staff in order to maintain the programs and deliver services, etc. So that was our primary lesson learned, and one that I would say that if if any of us or our agencies are impacted, whether it's by the coronavirus or any other catastrophe, that be mindful of of how we take care of our staff, because they've become such a critical asset to us. You can always clean buildings and repair them and put on new roofs from tornadoes or hurricanes, etc. But it's those individuals that make a difference in the work that we do, and that was our primary value of things that we wanted to take care of at that point. So that's all I really have to say and share. Looking back from that reflection, and I'm certainly open to any questions you may have, or hopefully, Gabe, that was the kind of things you wanted me to sort of touch upon.
Thank you so much. I'm actually going to start, Joel, with a question that came in to you, and I'm going to be bouncing back and forth. There was a question about whether or not you paid both full-time and part-time staff in full for that month.
We did. We actually.
And what your theory was.
Yeah, we did. We actually calculated for part-time staff, so lifeguards, people teaching classes, we did a calculation regarding what they were going to miss in terms of sessions or hours worked as well. And full-time staff was basically, they got their salaries. Teachers in our early child education programs got their salaries. And we did that assumption as well for part-time staff.
And for those line staff, just to clarify, because there's a few questions coming in, line staff, lifeguards, people would be paid hourly, things like that. How did you make a calculation? We
just said we calculated how many hours they would have been scheduled to work while we were closed, and then did the math and paid them, those in 2-week increments based on those hours they would have worked had we been opened. And again, I think it was a message, and I think you have to also keep mindful of the fact that the city was devastated, and we did not want to be the cause of any additional stress, and we made those commitments.
Joel, what ended up happening? There's a question about the second month that you were closed. Clearly, you made the commitment early on for the first 30 days, but what happened in that second month?
Well, what happened, Jen, in the second month, we started transitioning programs off-site because the building was not, we couldn't occupy our building. And so early childhood went off-site, our gymnastics program went off-site. So in the second month, those programs that went off-site, we obviously paid those staff. Those programs that, for part-time staff that were not off-site, we weren't able to pay the part-time staff. The rest of the full-time staff, if their programs were not operational, we have provided office space for them. We expected people to come back to work at that point. And we also, so I think that's how we did it. And staff that were that personally had homes that flooded, that needed more time after the 30 days than they were, after 30 days they were required then to start taking their own vacation time at that point.
Joel, you've talked a lot about staff, and I'm seeing several questions regarding members and families. Questions about refunding families, whether it was school programming, other programming, things like that.
Yeah, we did. Again, we made some tuition adjustments for preschool. We went into a month adjustment of 30 days. We deferred memberships. So again, I think it was recognizing that while the center was not operational, the city had been devastated. People were suffering, and we told people if we weren't providing services, that we would defer payments. We provided gift cards for programs and classes. We did a number of things as a way to help people and give the message that we were here to support them. And we actually, and quite candidly, we did it all without really understanding how we were going to cover it and pay for it. And we worried about that at a later point.
Thank you, Joel. I'm going to go back to some earlier questions that were posed for Jody and Dan. There were two things that I saw early on that just that people are looking for some clarification from our Redwoods team. So one, Jody, perhaps if you can respond to what happens during a voluntary closure. So clearly you talked about the scenario where a JCC or camp is being mandated to close, but what happens if they make a voluntary closure based on community quarantining or something like that?
Yeah, thanks, Jan. So based on the review of our endorsement, a voluntary closure and the resulting loss of business income would not be covered under the endorsement or the property policy.
Okay, terrific. The other clarifying question was that, several people are getting advice directly from their insurance providers also, and it sounded like you said earlier that the coronavirus is not covered under business interruption insurance. Is that accurate as a broad statement?
Under our endorsement and under our policy, I would say yes, ma'am.
Okay, terrific. Thank you. I'm going through some questions. You'll forgive me as I'm reading and trying to listen closely to the answers to make sure that other things are being responded to. It sounds like, Joel, this is a question back to you. Where ultimately, understanding you were making decisions on the fly, where did money come from to pay those 1 month salaries in the absence of fees as you look back? Or anything else?
So at the time, well, the money actually came from, we got a significant allocation from the Jewish Federation. They had conducted a international fundraising initiative. They raised the funds that helped, excuse me, let me put that on mute. And they raised the funds to help support it. And it was probably 8-9 months down the road. Again, I just want to reflect back, because when we think about staff and these decisions, it's really about the values that we subscribe to as CEOs and other leadership staff that sit on this call, and how we want to see our centers be perceived. And that's why the decision about how we handled staff and making fee adjustments at a time when there was a crisis was also related to who we are and how we wanted to be and how we view our role in the community. And so that was part of the thought process as well. And very short conversations we had with lay people, senior lay people and officers around what to do and how to best do it to respond to it.
Joel, that echoes a conversation that I know we've had internally and with several of all of our colleagues about both the legal responsibility and the moral and ethical responsibility. I will make some reminders at the end, but it's worth noting that next week there is a call to address some of the legal requirements that you've all been invited to participate in on Tuesday, to learn some of the legal requirements that we have running businesses when it comes to our staff. But Joel, you certainly raised the importance of the moral and ethical obligation that we have as employers also. So there's a question that just came in. It sounds like this one's going to be directed back to our friends at Redwoods. Is an epidemic or pandemic considered an act of God? Joel, I know you want to answer, but you can't.
Yeah, I don't know. I mean, that particular language, I would say, is certainly not in any insurance policy that I have ever seen. So I think that would probably be up for debate.
I think that's the question everybody wants a direct answer to, but it's the hardest one to answer right now.
Yeah.
I'm sure somebody's going to answer it for us at some point.
So I'll try. I have a partial answer to that question. I know that, for individuals, if you're working with hotels and they have certain agreements based on if you're having people stay there, and there's an act of God clause. For a gathering that we're looking at, it says, and if the local health department says that you must not travel to this community, that would be something that they would consider an act of God impossibility clause and would be covered. Whether that relates directly to JCCs, again, I would revert back to the broker. But I think anything voluntary, no. I think if there is a requirement that you can't open because of the local health department, that could be a conversation at the very least with your broker to entertain.
Thank you. You see, we've all learned a lot here at JCC Association in the last week. Joel, there's a question back to you. I think more than just on the refunds, a little bit more on the logistics of where did you actually move early childhood? I think if you could just, and not so much the specifics of that question, I think what our colleagues are trying to understand is how can they begin to think about other resources maybe in their community, physical space resources where other things may be able to take place. If you can respond to how any of that happened in Houston.
Sure. We moved a number of programs off-site. We reached out to churches in the area, schools, in facilities that were not flooded as a way to pick up services. So our Meals on Wheels program, which we home deliver about 350 meals a day, was in a church about 6-7 blocks from us. It was there for 3-4 months. Our early childhood facility, we have an indoor tennis center, which is the only area of the campus that didn't flood. And we converted the indoor tennis center into a big open classroom. And they were in there for the better part of 30 days until we were able to move them to a different facility, synagogues and temples. So again, we connected or reconnected to a lot of our partners to see what we were able to move off-site, and we thought about ways to be resourceful. We looked at some vacant shopping centers. We just we explored every opportunity possible that seemed to make sense. The whole point was to get people reconnected back to the center and programs and services. We prioritized what were the critical social services. So our meal delivery program and childcare were the top priorities, as well as then we ran a day camp for 2-3 weeks while the schools were closed at a Reformed temple. Again, because people needed the kids needed to be in some type of supervised care while parents went back to work or had to remediate and clean their homes. So it was just a question of taking program by program. We also made decisions regarding which programs were not a priority. We're not going to replicate because they were at the lower end of what we felt was the spectrum and how we were going to use and allocate our resources.
Thank you, Joel. Joel, it's not a question that came in, but I'm sure this is on the minds of many of our colleagues, because it's certainly on all of ours. Sort of the PR impact of the decisions that we make, and if you could just respond briefly to how the community reacted to the role that you took, positively or negatively, on any issue.
Well, I will share with you that how we responded in part. Houston's experienced a number of floods. This is the first time we had experienced a flood. As prior floods, we had been a supply center, distribution center for families and agencies in the area. So, and we did the same thing while during Hurricane Harvey. But the goodwill that we've gotten, the buzz from that over the years even so. The example that I'll share with you, Jen, and everybody else is we just announced about 10 days ago that we're embarking on a major capital campaign and renovation to this building, and announced a $50 million campaign, which we've raised a significant portion of that. And there was some Facebook postings. There's a Facebook group called Flood Recovery that's still in operation. And there have been a number of, probably a dozen comments on that Facebook posting about the center and its role in the community and what it did to help people in terms of Hurricane Harvey, and how great and how appreciative the center, how much the people appreciate what the center did in Harvey, and that people should stand up and help support this initiative now because we made a commitment, a recommitment to remain in the neighborhood. So, and if you and if you look at, reflecting also, if you look on some of the JCC associated benchmarking, there's a comment and question about, does the J make a difference in the community? These are how we go about making a difference, making these kind of decisions about how you serve and connect the people, and the true benefits and the values that play themselves out. And I also tell you that the benefit and values of how staff remember how they were treated at a time of crisis. And that makes a difference also in terms of their connection to you as an individual, us as CEOs, and also us as JCCs and entities, knowing that they were taken care of at a time of difficult times, and what it means to them and for them in their connection to their work in the community. So yeah, if I ever retire, I'll write a book one day about the values that the byproducts of some of these decisions that were made on the fly a couple years ago that have that really resonate with this community and this JCC now in terms of who we are and what we've become.
I think that may be the only reason we would let you retire, Joel. There's another question about, on a little more of the tactical side, is how did you actually go about communicating the closure with parents or others? Certainly in a time, that was different. There were phone lines that were down and other communication challenges. But if you could speak to that, and maybe just to add, would you do it any differently now if you were in a situation, let's say, related to the coronavirus?
So yeah, listen, I think what we ended up doing, this is before we moved everything to the cloud. A couple of days after we were able to get our servers moved to because we didn't have any electricity in the building, we were able to get our servers moved off site. And we began instant communications, and we were probably communicating, if not daily, probably every other day. And again, what we heard from people then, and what we continue to hear from people now is the importance of ongoing communication, and people expect it. And so following that, there were bomb threats, and now the coronavirus. We sent something out earlier in the week. People expect to hear from you, and they come directly from me as CEO in my office, and we learned a lot about the messaging communication that we were able to manage. You're able to manage expectations by keeping the communication flowing as much as possible. For us, it was about where programs are going to be held, getting programs back online, when facilities are going to be opened up, how to access the building, how to access services. So I can only tell you how important I think that communication piece is, and we learned a lot. And what we learned then dictates how and what we communicate now on a regular basis.
Thank you, Joel.
And everything was moved to the cloud. We also learned to do that. We did that very quickly after that.
No doubt. And Joel, just to be clear, was it only or primarily through email, or were there other ways that you were also communicating?
Email, Facebook postings were the primary ways.
Thank you. I want to go back to our friends at Redwoods with an important question that came up. Parts of this were addressed, but I'm going to ask it directly as it's written because I think this is really critical. So in the case of an outbreak like coronavirus, if the health department issues directives about limiting the size of gatherings or closing schools, community centers, et cetera, and if programs cannot relocate, what are the best types of insurance that might address the significant revenue loss related to that? So this is really about not only, and worst case scenario, certainly closing, but also the limit of large gatherings, things like that.
In terms of, so obviously with any question about a coverage, you need to look at your specific policy, because your policy will have the language that you are governed by. I think one of the questions at play that I hear is, what if there's an impairment of revenue as opposed to a closure? And in that sense, if it was a covered cause of loss, and it met the thresholds for triggering a business interruption claim, then you would have business interruption coverage even if you didn't have to close your facility. But the key in that I hear is it's got to be a cause of loss that triggers the coverage. Yeah. So whether it's a closure or an impairment of your ability to have programs, the insurance responds in a similar way. The real question when it comes to something like coronavirus is your policy going to consider that as a cause of business interruption loss?
Yes.
Thank you. Joel, we have a question coming back to you, and there were a couple of questions peppered throughout about this. Just going back to the refunds and reimbursements that you provided, if you could talk when you were closed, so whether it was fitness, early childhood, other programs, I think there's questions really, people want to understand what the mechanism was for providing those refunds.
Yeah, so what we ended up doing, Jen, is we communicated to folks, to our members, that probably 2 to 3 weeks in, we basically said to them, we know that there's going to be questions that members are going to have and concerns about their fees, their tuition payments, et cetera. Bear with us. Our computer systems, our business offices are closed. Give us some time to get our operations back in place, and then we'll respond in an appropriate manner, which is what we did. So I would say to you that we were closed for 2 months, and I think it was, so we were closed September, October. I think it was January, February before we were able to start to make adjustments. Most of them were obviously adjustments we made to people's accounts and deferring payments, et cetera. But the key piece was we took ownership, and we communicated to everybody and said, we know we're going to do something. Bear with us, and we needed to buy time. Not both time in terms of understanding the nature of our decision because of the precedent it was going to set, but we just didn't have the mechanisms in which to do it. But we said to people, we know we're going to do something, just be patient with us.
Thank you, Joel. I think that's important guidance for all of us, and I think the candor and the transparency was critical, and it's a reminder for us in how we also manage the communication. A couple questions going back to Redwoods, and some of these have been asked, and because the questions are coming back up, I want to make sure that we're all very clear about this. So Dan and Jody, we appreciate your patience on this. People want to know, inquiring minds want to know. They want to make sure that there is not insurance available, business interruption insurance, in the event of a pandemic.
Not that I'm aware of. Now, there may be some other companies, some other policies that have addressed that. I believe that ISO is currently working on an endorsement that could provide some coverage for that, but I have not seen a coverage form or an endorsement that addresses that specifically.
So ISO is the Insurance Services Organization, if you don't spend all day thinking about that like Jody and I do, and they are the ones who are the backbone for insurance providers. So in your, if there was to be coverage in your policy for a closure of your organization, it would come through business interruption. Whether a virus triggers your business interruption coverage that seems to be the question. Jody is much more knowledgeable than I am about this, and we cannot recall there being a policy specifically written for a pandemic. It's worth asking your broker if there is one, but it's not one that we are familiar with. And in the absence of that, and in the absence of the Insurance Services Organization having created one, your best bet in terms of understanding is is to look at what are the components of business interruption.
There were a couple of questions, Jody and Dan, that came up related to the kinds of coverage policies that Redwoods offers. And rather than ask the question directly that way, I'm going to sort of amend it a little bit with permission to ask, you can certainly respond to that, but I'm curious, insurance company to insurance company, what would make one insurance company offer a particular kind of policy versus another? And I don't mean that in the theoretical, I mean it in the practical. So as everybody's going back to their own insurance company to look for these things, are there things that you've talked about that are atypical of most, but typical or specific to Redwoods? Or are most of the things that you've talked about consistent with what most insurance companies would offer? Whether or not that's part of one's policy, I understand is different.
Okay. Whether or not an insurance company, or I guess what you're asking is what type of policies would an insurance company offer? Based on my experience in the commercial lines, you're going to see, typically you're going to see a cause of loss special form, which is going to identify the causes of loss that are covered. You're going to have a building and personal property coverage form that tells what is covered if something happens, if a cause of loss is triggered. And then, for this conversation, you would go to your, loss of business income coverage form that is pretty typically standard in the commercial property line of insurance.
That's actually a very non-wonky answer to that. I'm really impressed that you were able to do that, because there is, believe it or not, there is a really wonky answer about how you file endorsements or amendments to insurance policies. So we mentioned the Insurance Services Organization. They set a lot of the standards for how insurance can and is written. And so insurance companies do choose to make amendments to their forms, whether it's to add coverages or to limit coverages, whether there's coverage at all or how much coverage that there is. And it's really based on the insurance organization. So it's definitely worth looking. I would echo Jody's comment that you tend to see insurance written in similar ways. And so you can definitely find differences in insurance policies. But in terms of, will you go out and be able to see an insurance policy that says, in the event of a pandemic, you will have business interruption insurance? That one stretches what we would expect you to be able to see. But certainly everyone's going to be thinking about it more now and in the future after this.
Thank you. Thank you for answering it very directly, too, to both of you. Joel, question coming back to you. In the end, what ultimately did you end up refunding? Or maybe the easier way to look at this is, was there anything programmatically that you chose not to refund?
Anything programmatically we chose not to refund. No, I think we ended up making, so we ended up doing, Jen, what I recall is a series of one-off decisions. So we made, so we looked at programs based on how long they had been shut down for, where they had, if they were moved off site, and when we anticipated them reopening, and made decisions in that manner. And then we also did some membership adjustments across the board that were consistent for the different categories. So again, it wasn't a one size fits all. It was really done as a way to address specific programs and based on how the timing, how long they've been closed for, and our ability to move them off site.
Thank you. I'm going to pause for one moment to see if there are any final questions that come through the chat. So remarkably, maybe you're all looking at the clock like I am, but we are about 5 minutes left on the call. I want to just share a couple of things before we end. First and foremost, I want to thank Joel, I want to thank Dan and Jody for sharing with us invaluable information. It is remarkable, and certainly by Gabe's design, but I think the three of you talking to us together provided a complete picture, more complete than either one of you alone, certainly, and I think that it was invaluable. I believe that we got to all of the questions on the chat. That said, you will be sure that we will scour that chat very carefully. If there were any questions that we didn't get to, first and foremost, I apologize. But secondly, we know who asked the question, and we will certainly be sure to follow up. I also want to point out that this whole thing has been recorded, and I'm imagining that we can make that available and plan to make that available. So if you want to share this with anybody else within your organization or colleagues that were not able to join, I want you to know that they will be able to access all of this information. And you should know that all of the calls that we've convened in this way are being recorded for that purpose. I know there are several questions about links to the information for calls next week. So we will be sure that that is shared. There's a communication coming later today that will include the schedule of calls and links to join for that. The one that we already mentioned is on Tuesday, March 10th, about HR and employment-related preparation and policy recommendations. It is a law firm specializing in workplace law. Gabe sent something yesterday, but again, you will get more detail about that again later today. I'm also very pleased to announce that as of this morning, Gabe confirmed another call that's scheduled for next Friday, what we are calling On the Front Lines, and it will feature a call with three of our colleagues, Amy Lavin from Seattle, Marcy Glazer from San Francisco, and Deanne Foreman from Riverdale, who will be talking about what they are doing as three communities that are facing outbreaks. It includes local school closures, affected members. They will share real-time lessons with us about how they're navigating things. You can imagine that between now and then, I'm sure they will have even more to share. I want to thank the three of them if they're on the call, and if not, please make sure that you thank them for giving us their time next week.
Hey, Jennifer, it's Amy Lavin, and I'm sorry to interrupt. I am on the call. I think that there's two things that I sent you a couple questions that I just want you to look at in your email because I'm dialed in on the phone. And so I can follow up with Gabe, but I did send you a couple that I think are relevant to preparing for next week with a slightly different lens.
Terrific. Thank you so much. That's a great reminder. As you've all likely seen, we are also calling for resources to add to our own knowledge base, especially emergency response plans, and for those that have them, infectious disease response plans. Please send those to experience@jcca.org so that we can be sure to include those on our jcca.me portal. But Amy is also reminding me to remind all of you, if there are other resources that we can provide, calls like this, experts that we can help convene on behalf of the field for your JCC or camp, please let Gabe know. You can use that email address or reach out to any of us directly. It is a top priority, I can assure you, here at JCC Association to make sure that we're providing every resource that we can out to the field. I want to thank all of you for participating on the call today, but once again, with specific thanks to Dan, Jody, and Joel for your leadership and participation. Shabbat Shalom, and thank you.